Well, hello and welcome to today's event. I'm Carol Flagg of Answers Media Network. Thanks for joining us today. Our webinar today is Critical Condition, Business Continuity Planning in an Always-On, Cloud-Connected, Patient-Centric World. We appreciate your time. A couple things before we begin. During the event, you can use the question feature found on the GoToWebinar dashboard to pose a question for the panelists. A copy of this event and the slide deck will be emailed to you within 24 hours. And of course, as always, if you have any questions as we go along during the event, you can email me directly at carol@hightechanswers.com. So I'm going to introduce our panelists for today's event, Molly True and Jan Bates. Molly True is a healthcare marketing strategist for Windstream Enterprise. She has a deep experience in the network and health IT space and holds a certified associate in health information and management systems and from the Healthcare Information Management System HIMSS Society. I don't know if I got those acronyms right, but I think I did. And she's a national member of HIMSS. Molly joined Windstream from Avaya, where she was a senior healthcare marketing manager. She has an MBA from Meredith College and a BS in computer science. She can be reached at molly.true@windstream.com. Joining her is Jan Bates. She's a senior IT leader for the University of Kentucky Healthcare, an academic medical center in Lexington, Kentucky, and is director of systems operation. Jan has oversight for the data center, infrastructure, networking platform, storage, and visualization teams. She has 25 years of health IT experience, and she has planned and implemented 2 data center facilities that have been instrumental in system availability improvements for the enterprise. Molly, Jan, thanks so much for joining us today to present on this very important topic. Molly, I'm going to go on mute and turn the presentation over to you, and I'll see you back on the Q&A.
Okay, great. I'm going to advance to the next slide, which I'm having trouble doing. So I'll go ahead and try it one more time. Let's see, down. Let me see. The slide is not going forward. Maybe Carol can move it forward. So
if you, whoops, Molly, if you hover in the lower left-hand corner, do you see anything there?
No, I don't.
It pops up on the screen?
Oh, now I see it. Okay, sorry.
Okay, no worries. I'm going to go back on mute. Just a little trick there.
Okay, no problem. I see it now. All right. Hi, good afternoon, everybody. This is Molly True from Windstream, the healthcare marketing strategist at Windstream. So first of all, I just wanted to talk about some of the trends. I don't think any of these trends are a surprise to anyone on the phone, but I just wanted to talk about some of these trends, and specifically these 4. There's more than these trends in healthcare, but specifically these 4 because we see these as driving impact and change to the data center and driving data center transformation. So first, I wanted to talk about value-based payments. So this overall trend is being pushed by regulators and others in the industry to move from fee-for-service to value-based payments or based on the quality of care provided. And the overall goal of that is to help bend the cost curve and take costs out of the healthcare system in the U.S. while still improving patient outcomes. I think everyone agrees this is the right direction, but maintaining financial stability in this new world is pushing providers to look for predictable costs, which is driving data center transformation and a more aggressive push to the cloud. I wanted to give some weight to this that everyone agrees. There was a recent article about 2 weeks ago where the 5 major health system CEOs were recently quoted as urging Congress to work with them on the new legislation. And they also said that more payments must be made through value-based contracts. So I think there's definitely a lot of folks in the healthcare industry seeing as this is the right direction, but how you actually change your health system, and kind of riding the fence between fee-for-service and value-based payments. The next trend I want to talk about is population health. So tackling population health management is definitely critical to also affecting that cost curve, with 4 out of 5 healthcare dollars being spent on chronic care. And in order to reduce the spend for these chronically ill patients and intervene with preventative care, analytics is very important for determining how they should intervene. And population health management applications are in many cases being deployed in the cloud with all the data coming from various sources. But of course, underpinning everything is the patient, and the purpose of gaining those insights is to deliver better outcomes for that patient and the overall population. So next we're going to talk about healthcare provider consolidation. So that continues. It's been happening since the passage of the Affordable Care Act, and it continues as it becomes tougher for smaller providers to keep up with the changing regulations and the operating overhead. Healthcare organizations, as they acquire new locations and merge with other organizations, now have the struggle to deal with consolidating all their IT systems as well as a part of that consolidation. And as they have cloud-based applications, that can make that consolidation a little bit easier. And we also want to talk about data breaches, ransomware, and cybersecurity, because as you're moving to the cloud, this is a concern that has been a barrier to move to the cloud in the past, and still top of mind for healthcare organizations. And it's is a primary requirement for applications to transition to the cloud to protect patient health information. So I'm going to make sure that I can do this arrow. Aha. Okay. So I'm going to the next slide. I've got this now. So this is driving those trends, and others are driving these needs in the healthcare industry. So in order to meet these challenges, healthcare providers must find new ways to improve patient experiences, protect patient health information, improve productivity, and maintain business continuity. And I want to spend a little time in this webinar talking about business continuity. So the next slide I have, you see, is a plane, and you're like, why are we looking at a picture of a plane? Well, I just want to spend a minute talking about diversity versus redundancy, and this is sort of my picture to object lesson, I guess, to talk about diversity versus redundancy. So this twin engine plane, it does have redundancy because you have more than one of what you need. You do need at least one working engine. Unlike the plane that landed in the Hudson, it didn't have any working engines. You do need at least one. But diversity is having two capabilities with different characteristics. In this analogy, that would be a second plane carrying the duplicate cargo in case you lost the first plane. So when you apply this to network access, that diversity entails two distinct physical access methods to reach a customer or building. Ideally, this diversity would also result in no single points of failure at the last mile, at the transport layer, or at the service layer. While all diversity does include redundancy, not all redundancy is diverse. So hopefully this picture helped you talk about diversity versus redundancy. Next, I want to dive in a little bit more into business continuity and how that's changed, and what are the today's table stakes relative to business continuity. So the cloud really has magnified the impact of those outages, specifically last mile outage. It's as you move applications to the cloud, you can be more vulnerable to those outages. Interruptions can lead to impacting patient care. So especially as you're starting to move those patient care applications to the cloud, it does point the need for simple, affordable, scalable solutions for addressing what might happen. Redundancy is good, but diversity is better because it helps eliminate single points of failure, whether that be cards, boxes, last mile network access, power, backhaul route collapse. Any of those failures can expose you to outage, and probably one of you on the phone has experienced some of those problems in your past life. So diversity of the past, you had large healthcare organizations, and even though we have this consolidation going on, the issue is having the budget and the know-how to develop your business continuity solutions in-house. And the diversity of today, you have growth-oriented organizations that are taking advantage of applications and real-time communications in the cloud. And so you just have a little bit different challenge today than we did of the past. And this highlights the need to review your network and your infrastructure for single points of failure that can expose your business and impact patient care. So I wanted to talk about the need for purpose-built diversity, and just wanted to show you a diagram about this. So let me just point out some key components of this diagram. First, on the left, the need for continuous power. So not just diversity in your in your network or in your application load, but thinking about that continuous power source and having diversity in your power. And in the middle, I want to talk about the need for diversity needed in access. So there's many different types of fiber access, but thinking about other options like maybe a fixed wireless that's completely diverse from your fiber that's in the ground. And third, the need for diversity at the transport layer. There really is a need for purpose-built diversity that keeps network endpoints connected, even in the event of a serious network issue or power outage. And especially in the healthcare industry, as we move our more applications to the cloud, it's even more critical for patient care and being able to serve patients, that you have a diverse solution, and no matter what might happen, that you can still access those applications. So next, I want to give you guys a quote. So before this webinar, I didn't know who had written this quote. So a chain is no stronger than its weakest link. So that was actually a quote by William James, who was an American psychologist and philosopher, born in the 1800s. So it's probably not that surprising. I didn't know who the quote was. So anyway, look it up. It was interesting to find out more about him. But this is just another thought to give you another way to think about single points of failure. Think not only about the applications and how to recover them, but also the network as the foundation of those applications for delivering patient care. And any single point of failure would be that weakest link in the chain of delivering care. So I also wanted to talk about, as we're going through this transition, that wide area networks or WANs are becoming harder to manage. And why is that? So we're seeing the most dramatic change in networks is the amount of traffic that's destined for the internet or the public cloud. So traditional networks, they were designed to only connect to the internet via maybe your main hospital or your data center locations. And that's definitely changing in healthcare as you see all the clinic locations needing to access applications in the cloud or through the internet directly. And a new kind of network is needed in order to make that more feasible and flexible, and cost effective and easy to manage in this new environment. So as demand for cloud applications and services continues to grow, healthcare organizations are relooking at their WAN strategy and architectures to optimize business efficiencies, protect critical data, and enhance the patient experience across, various types of public, private, or cloud paths. Next. So specifically, I wanted to talk about SD-WAN, or software-defined wide area network technology. This is an overlay network technology that uses the principles of software-defined networking technology to decouple the network intelligence and configuration from the physical connections and hardware to create a centrally managed virtual WAN, or wide area network, that connects distributed clinics and remote locations, no matter what kind of connection type, access point, or carrier. It can help deliver everything you need to future-proof your healthcare organization for the cloud era, including providing flexible connectivity options to improve clinical application performance, provide a scalable voice and data hybrid WAN technology, allowing healthcare organizations to scale bandwidth more affordably, and also improve business continuity with the hybrid WAN technology. So now that I've spent time talking about the trends driving change in healthcare and the network technologies available to take healthcare organizations into the future, I'm going to turn this session over to Jan Bates, a senior IT lead at University of Kentucky Healthcare, so she can talk about what diversity and business continuity looks like in a live healthcare environment.
Thanks, Molly. First, let me take a little time and introduce the University of Kentucky Healthcare. We are a 925 inpatient bed facility with 2 campuses. Last year, we did 42,000 discharges. We're a level 1 trauma center. We did 120,000 ED visits last year. We did 1 million clinic visits in 2016. And we have centers of excellence in cardiology, oncology, and neurosciences. We have a Kentucky Children's Hospital with a level 3 NICU. We have NCI designated cancer center, and we have 80 specialty clinics and 150 outreach programs across the state. University of Kentucky also has 6 health profession colleges. So that's enough. That's a little bit about us and what we do. Then I wanted to identify some of the opportunities that I think all healthcare organizations face. You're trying to drive out the single points of failure in your delivery of care. You're forced to respond to the ever-changing vendor requirements and how you have to react to meet those requirements at a moment's notice. And then you're managing your infrastructure and staff in this hybrid environment that you've created. The items to note about our solution is you want to build a redundant power and UPS system. We secured co-location space with Windstream. We leveraged our campus connectivity to that co-location space, and we upgraded our network and built in redundancy. We also added fiber expansion so that we knew that it could handle the load that we would be increasing as we looked at some of our business continuity needs. And the result is that the network is more redundant. It has increased bandwidth. We have a scalable infrastructure to support our clinical applications, and it also enhanced our service level agreements. Now, next I want to talk about our medical grade network. So we were a Cisco network shop, and so we deployed Cisco's medical grade network, which has 4 components. The 4 components are protection, interaction, responsiveness, and resilience. So a little bit about each of these. Protection, in this category we have PHI, and it must be delivered in a secure manner. Healthcare must meet several security specifications like HIPAA, PCI, and HITRUST in order to deliver the protected information. Now, interaction, in this phase, or in this block, the patients and clinicians are required access to medical information to deliver today's enhanced patient care model. Responsiveness, it is bandwidth that is included in this area, but it's also the ability to meet the ever-changing clinical demands. As we know, the bandwidth can change very quickly, and you may need to increase that. You have to be responsive, and your network has to be responsive to meet that need. Resilience, this is where we go through and eliminate those single points of failure that Molly mentioned earlier to maintain our continuously available network. We want to provide a concurrent and maintainable environment so that maintenance can be performed without downtime. This will allow us to maximize the uptime for all of our critical systems. So the medical grade network is something that we apply across the board, but then we began to look at our business continuity approach. So we did some pre-work in the beginning for this project, and our pre-work was first that we did a clinical impact analysis of all of our applications to determine the importance of that application. We defined the RPO, or recovery point objective, which is the amount of data the business is willing to risk or lose in the event of an outage. We then determined the RTO, or the recovery time objective. Now, this is the amount of time you will take to recover that application. And then we validated that our failover plans and our restore procedures could meet this RTO. So then that was our pre-work. Then we divided our business continuity project into 3 areas: network, storage, and cloud. But these were kind of our sub-projects. Now these sub-projects made sense to us because these were 3 specific areas that required a lot of hardware and infrastructure and equipment to be implemented to accomplish our business continuity plan. And cloud was the third sub-project. The reason we kind of made it as a third project is we don't have a very large cloud presence today, so we thought that running the cloud components in a separate project made sense for us. So that's kind of how we broke down the project initially. So now I'm going to move on to our network topology. So if you look at this slide, over in the left-hand corner is our legacy data center. Our plan is for this data center to become our test and development data center, but we have to move our production, any production equipment that's in this legacy data center to our primary data center, which is the data center that's pictured in the center. And then over on the far right is our co-location data center. This is where we plan to put a lot of the failover equipment and do an automatic failover without any user impact at all. So these three data centers that we currently have, the network topology that we're using to deploy our business continuity plan is Cisco's ACI, or Application-Centric Infrastructure Network. This is a software-defined networking solution which delivers hardware and software capabilities through a unified application-based policy model. It increases business agility and lowers the total cost of ownership by automating the IT task, enhancing security, and increasing operational efficiency. We are deploying this model in all three of our data centers, the legacy data center, the primary data center, and our co-location data center. Now I'll move on to our business continuity design. In the top portion, this data center is our primary data center where we have our clustered environment. So that's represented by the two boxes or the two servers. Those are cluster failovers. And then on the bottom is our co-location facility. In our business continuity design, we decided to limit the clustering in the co-location data center, which meant that in the event of a failover to our co-location data center, we would run our systems, but only until the primary data center functionality could be restored, because we knew we would be running in a lesser failover capability in our co-location data center. Now this is a design decision. We could have designed our co-location facility to have the same clustering capabilities as our primary data center, but because we were not planning on running in the co-location facility for an extended amount of time, we decided to accept the risk of operating in a non-clustered environment. I mean, the cost didn't weigh the benefit when we knew we could fail back over to our primary data center. So now kind of on to the storage piece. Our storage project that we did, it has the metro mirroring to get the data over to the co-location facility for failover. But another piece that I thought was important and sometimes missed is it also includes your backup and validation. So this piece is critical if you're responding to a cybersecurity attack or really any disaster. As you review your business continuity plan, there will be some applications that are simply restored from backup. And this is also important as you think about your response to cyber attacks. Your first line of defense for a cybersecurity attack are proactive measures like patching and intrusion detection. However, you want to validate your backups and that they're in place and that you can get a good restore from those for all your servers in the event that that's your line of defense. So what we created was an audit process to validate that the backups are in place for every server. And then from that, we created this monthly report that shows the total number of Active Directory servers, and then we cross-reference that with our TSM backup list. Now, each month we work that delta to make sure that we have a backup in place. And then this audit process, it shows that there may be some reasons why you won't have a backup for every server. So just to name a few of them, one instance we found that a server was in the process of being decommissioned and hadn't come out of the Active Directory list. Another instance was it was a clustered server, so we were backing up cluster A. We didn't really need to back up cluster B. And then some of your Citrix provision servers, you don't have to back those up. You just make sure you have a golden image. You wouldn't be restoring that server from a backup in the event of a failure. So now as we move on to cloud, our security team worked with our SharePoint team and created a site that they could load a lot of information about our applications. And these were the cloud readiness criteria that we used to validate whether an application would make a good candidate to move to the cloud. One of the things was number of users. And this just weighs the risk. If it's widespread across your enterprise, it would increase your risk of an issue in the event of a problem. Required time to deploy. This may make it more suitable or less suitable for the cloud, just depending on the timing. A business associate agreement for all of our cloud providers, we have to have those in place. And sometimes those take a while to get those contracts in place. So this just let us know if we already had one or not. And then the flexibility of the contract terms with each cloud provider. We wanted a flexible relationship and a flexible contract. Our hardware life cycle, typically our hardware we try to keep in production for 5 years. If I just purchase that hardware, that may make me want to wait to take this application to the cloud to a little bit later, unless I can reuse that hardware somewhere else. The application tier, and then the amount of patient health information that's in that application. All of these things go into a cloud readiness score, and it makes us base our priority of moving things to the cloud. So as we continue our future business continuity planning, we will continue to evaluate our applications and determine the business requirements. Some applications require an automatic failover. That may be delivered best from a co-location facility. Others may be better suited for cloud, and some of our less important applications will be accommodated by simply restoring that application. Just some suggestions to think about as you work through your business continuity planning. In co-location data centers, make sure you have the required network connectivity and bandwidth to support your application. So if you're doing nightly backups to get that data across, make sure you do some measuring of how much you're sending across that network. Even if you're doing it at night, you don't want to cripple your network at night. For cloud environments, make sure you've budgeted for cloud costs in case you need to run in the cloud for a disaster recovery. So for instance, if your answer to business continuity is to put something in the cloud, but you're not running there, make sure you have a budget in case you have a disaster and you have to run in the cloud for an extended period of time, because those dollars can mount up. And for restores, make sure you're validating those restores and that you have tested the restore of those backups. Because in many cases, if you miss one file, it can mean that it can invalidate the backup. So you really have to test those.
Hey Jen, can you spend a minute on your governance process too? I think you were going to mention it later, but I thought it'd be good to talk about now.
Okay. So yeah, one of the things that we do is as we make our standards. So our standards are our medical grade network. Anytime we fall short of that standard, we ask the business to sign off on a risk acceptance form. So I'll give you an example. We had some construction going on in our facility, and the fiber for the dual network was not ready yet. It was going to be 2 months later than when the department needed to move. Now the department moved, but the network was there. It just didn't have the built-in redundancy, and therefore didn't meet our medical grade network standard. So we filled out a risk acceptance form and took it to our IT governance board, and made sure that they were willing to accept that risk for those 2 months until we could get the additional fiber run. It does two things. There's a couple of reasons why I like that governance. One, it gives me an opportunity to share with the business on a little more frequent basis. We are taking this serious, and we have our standards in place, and we are really keeping the network up and keeping your best interest in mind. And two, it lets them know I'm on it, and I'm going to let you know when things don't go right. Which leads us into this next slide of when things don't go right. First, I'm going to talk about when things do go right. We'll do the positive first. So one of our instances, we had a duplicate Centric environment in our co-location facility. So we had an unplanned downtime, which affected our production Centric environment. But because we had enough resources in our co-location facility, we were able to fail over without any user impact. Once the Centric environment in our primary data center was restored, we just fell back to the primary data center. And our users never knew the difference. They never knew which data center they were operating out of. So it was definitely a success. Now, we also want to talk about when things go wrong. And in my 30 years of IT experience, I've seen a lot of things go wrong, and a lot of times it's usually those things that go wrong that are etched into our memories the deepest. One example I can remember, we had dual NIC cards in a server, and those servers went to 2 different uninterruptible power supplies. However, one of the uninterruptible power supplies were not plugged into an outlet. And of course, the UPS that had the failure was on the one that was plugged into the outlet. So when the battery power was depleted, we had a failure of service. So I guess my advice there is you can plan for redundancy, but when you have to check all the way down to the most simple pieces, because that can usually be what causes your problem. And most of the time, it's those simple pieces that are overlooked. And there will be some times that you have to reduce your standard for business reasons. Here's another example of that, and I'll go into a little bit again about our governance. For example, in the data center, we had a UPS that was they were not redundant UPSs, and because of the lack of power in there, we had to run 2 switches to the same UPS. We knew we were short on power. We knew we had to do it. We knew it didn't meet our standards. So we did have to take that again to governance and ask them to sign off that they realized our risk, but because we didn't have a choice, that's what we were going to do. And here's the things we were going to do to mitigate that situation.
And Jan, did you actually have an outage in that scenario where you had the unduplicated?
Yeah, we had.
Okay.
Yeah, we had. It was human error that somebody accidentally took the UPS offline, which dropped the power in that room. So it was a huge outage for us, but it was all because of that lack of redundancy. So I think the most important thing is that when you find a lack of redundancy or that single point of failure, you really point it out. And that's the other thing by taking it to governance that really helps you, is to make sure they're in that risk with you.
Well, did you have more to add? I guess I was going to wrap us up with our recommendation slide.
Yeah.
Okay. Okay. Maybe we can add some more when we have some questions and stuff. So we just wanted to make some final recommendations. So one, I think virtualization. There are going to be times when you can't virtualize an application because it's a heritage application, but where you can virtualize, it not only helps you when you have to recover an application, but if you virtualize something, it makes it so much easier to move that application to the cloud if you've already virtualized. So that's definitely a recommendation if you haven't fully virtualized, to take a look at that. And the second thing is application recovery. So like Jan was mentioning earlier, kind of thinking about what is that amount of data that you can afford to lose. If you can't afford to lose anything, that you know that, and what's that time recovery that it's going to take you, so that you actually have tested that process to recover those applications. And then that was a key learning for me. I know out of this preparation for this webinar was the backups. So not only just doing the backups, but making sure that it's a valid backup and that you've actually done all those backups. And then if you have a need for replication, so that would be for an application that really can't afford any loss of data, that you have some kind of replication process in place.
And Molly, let me add there on the replication. So there's two types of replication. I mean, you could do an automatic failover. You may feel like the business could, it's okay to have a replication, a manual replication that takes 30 minutes or an hour. So you really have to let your business or your healthcare systems tell you what their tolerance is for that outage.
Yeah, definitely. I mean, it's all about what is that requirement? What is the requirement for the business for that application? Like you said earlier, there may be some applications where you can just recover from backup. So you were mentioning, I think, Jan, I don't think you mentioned in this webinar, but you were talking about there was an application that your finance team uses, and they only use it on like a monthly basis, I think you said. So they're, so the need to, have some kind of automatic failover or failover to a cloud application, you didn't really need that kind of thing. You just could restore it from backup. So. Right.
And so it's the way you tier those applications, and you have to really know each application. Then the other piece that I think a lot of times are missed in that backup and replication are what are those infrastructure pieces that are required. The DNS, the Active Directory, all of those pieces, those are some of the most important pieces to have replicated across the board. Because if you miss those, nothing's coming up anyway. So.
And then finally, we had network diversity. So Windstream is a service provider, so we have to end about network diversity. But you really do need the network in order to access those applications, whether they're in your data center or you have actually moved into the cloud. The network is really important, and having a diverse network is very important. And I think also Jan mentioned when we've talked earlier, as you go to the cloud, it's even more important. So if you just have one connection to the cloud, and wherever that cloud is, whether it's you've decided to go partner with AWS or Microsoft Azure or another cloud partner, you still need to make sure that you have diversity in the connectivity to that cloud provider. So network diversity is really important, and making sure you've scaled your bandwidth and your service level agreements along with what your requirements are. So I think did you have anything more to add, Jan? Did you want to talk more?
Nope.
Okay.
I don't think so. I think that was it.
Yeah.
Okay.
And yeah,
I think we're finishing a few minutes early.
Yeah, no worries.
But,
no worries. We've got some questions coming in. Maybe leave it up on this recommendations slide. That would be great. You know what I mean? Just, yeah, cool. All right. So yeah, we've got some questions. And before we dive in here, I just want to remind our attendees to use the question box, the toolbox found on the right side of your dashboard. And to those of you who are chatting or putting in the question feature, yes, you will get a copy of this recording as well as a copy of the slide deck out to you probably within 24 hours of the event. Okay. So first question, how important is your medical grade network in delivering care? What's the relationship there?
Okay, I'll take that. Our medical grade network is very important in delivering care. And like I said, I mentioned before, we partnered with Cisco for our networking equipment. And they work with us to ensure that we have the right planning. We have a great networking team, and our campus is also works well with that. We're ensuring redundancy and failover capabilities in our network, and that's the first step in providing uptime for all healthcare applications, is that network redundancy and diversity. As I mentioned before, I can't say enough about how important I think governance is in the whole piece, to make sure that I keep the business aware of how important the medical grade network is to me, and that we are really keep upholding those standards. So anytime you cannot meet your medical grade network standards, you have to ask the business to sign that risk acceptance form, just so they have taken on that ownership.
Okie doke. What other network technologies are important as we transition to the cloud?
Jan, I'll take that, but feel free to jump in if you want to. First, let's talk about network diversity. So I think that's definitely our recommendation, to make sure you've looked at your connection to the cloud and make sure that that's diverse. So that's an important piece to look at. And then also, as you're moving to the cloud computing really requires dynamic computing and a high degree of automation to address rapidly changing demand. So further investing in software-defined networking and network functions virtualization, or NFV technologies, that'll continue to move toward network virtualization and automation to support the flexibility and the business agility that's being demanded by the business.
Okay. Can you talk a little bit about how our response should be different for different types of outages? For example, a cybersecurity incident versus a power outage or a weather incident.
Okay, I can talk about that. So for, anytime you're working a problem, it's the unknown that you're trying to guard against. So I think the cybersecurity is a more difficult problem, because you're not really sure what that unknown is or where that attack is coming from. But I think with both problems, whether it be a cybersecurity problem or a power outage problem, you have to do your proactive measures first. So with the cybersecurity, you have to do your patching, you have to do your intrusion detection, you have to protect your systems. All of those are proactive measures that you can do. For a power outage, you have to build in your redundancy, you have to build in your diversity. All of these items are proactive things that you can put in place. Now, when you're taken on a power outage, the unknown is what damage was done to the equipment when that power outage happened. So actually, both of them have a lot of unknowns that you're just working through each issue. With power outages, you may be fixing one problem just to bring up that next step to find out there's another piece of damaged equipment. So it's very single-threaded as you work through all of those. But again, I would say that the most important thing for both of them are those proactive measures. So everything you can do to prevent the cybersecurity attack and the power outage.
And of course, power outages sort of come in different flavors. I mean, there's a power outage that can be very, very short term, and then those that can be very extended, perhaps due to, a hurricane situation or an earthquake in California or a tornado, where you could have a power outage for several days or actually many days, right?
Right. And if you were in that, you would just deploy your disaster recovery plan and move forward that way.
Right.
If you're doing in a smaller outage, and I was thinking more of a self-inflicted outage or something that may have been caused because of a lack of redundancy that was in place, then you're fighting to get your systems up either in your co-location facility or your primary site. You're trying just to restore the functionality.
Right. Molly, you
And,
were going to make a point, right, Molly?
oh, yeah, I was. I was just going to mention that Jan had said to me previously that it's also about partnering, especially with cybersecurity, partnering with your security group inside your company. So you were saying, Jan, that you're very connected with your security team inside of.
Yeah, I was going to mention that. So we have in our security team, we have a vulnerability group, and they're continuously searching for vulnerabilities within the system, kind of looking at what's out there. So sometimes that can be more difficult because you've got to worry about the communications across two teams, and you have to have that good relationship. But then on the other hand, the positive to that is I have more resources because they're out there checking the vulnerabilities and providing a lot of input to us. And then the technology teams are the ones that are doing the patching or mitigating those risks as we move forward.
Okay.
Oh, there was one other point I wanted to make here. Sorry.
Oh, no worries.
Ransomware. So that brought up a question for me with Jan too. Was ransomware a little bit different? And I think she was mentioning to me that, that some of that concern about ransomware is how they develop this process of doing the backup validation. I don't know if you want to comment on that, Jan.
Yeah, it's actually one of the questions from the attendees. How does your approach differ with ransomware versus a cybersecurity incident per se? Obviously, ransomware is when somebody hacks in your system and is in essence holding your data for ransom.
So for us, that's where those backup validations come in play because we just restore from backups. And ransomware really brought that to light for us. I wanted to be able to have something that I could show our CIO that we do have valid backups, and this is our proof, right? I mean, it didn't happen unless I can prove it happened. And so this is our proof on a monthly basis, and we all are only human. So I wanted to validate out of 3,000 servers that we weren't missing something. So we did this check where we run a report from our Active Directory that I talked about in the slide deck, and then we cross-reference that with our TSM report, and then we do testing randomly of several of those restores to make sure that those restores are valid.
Okay.
So that would be our response to ransomware. We would simply restore those applications.
Right. Do you suggest having a separate network specifically for medical equipment so that medical equipment is isolated from general network traffic?
We do have a separate one. And, it's a pendulum swing, right? The pendulum goes back where it's separate, and then it goes back to more of a converged network. So you're kind of in the middle of that pendulum swing right now. But yeah, I think it's safer
To isolate the two?
to have them separate. To isolate the two, yes.
Yeah. Okay. On another, I'm not familiar with this acronym, but do you suggest using an MPLS setup? Does that acronym?
So yes,
Yeah, that's right.
that acronym is multiple protocol label switching, and we are we are deploying an MPLS typology.
Okay, right. How often should we be updating or documenting or changing our continuity plan?
So I would say that you would want to test it every 6 months, and you want to update it every time you test it. I mean, that's what I would say. Now, you may not get to every application, so at least yearly, but if you plan it to do that continuity testing and review every 6 months, then you're gonna put updates in it like that. That would be my just off the cuff answer.
Yeah, I would say, Jan, at least yearly you should be testing it because things change. Even if you put that business continuity plan in place fairly recently, if you're not at least revisiting it once a year. I mean, a lot changes in a year. So.
Okay.
Right. And the reason we did before every 6 months was because, I do it every 6 months. I may not get every application, but it would ensure that at least once a year I got every application. So we did a specific testing every 6 months.
Okay, all right. We are a small medical provider with 30 providers operating in the cloud. Who should be involved in the continuity planning itself? Who on our staff? I believe I'm interpreting the question correctly.
So I'm assuming, so I think you're going to have to involve the business, right? The business has got to tell you, like we talked about in there, what's your RPO, what's the data they're willing to risk. So you could have somebody work with the business and document that, and then go to your cloud provider and verify that you're meeting those needs. But I mean, your business has got to drive it.
It would include, like, if you're thinking about a 30 doctor practice, I mean, it would probably have to be at least your primary physician or something, your administrative physician would have to be involved, because they understand, their requirements, what kind of applications are more critical to them than others. So you're going to have to involve, somebody from your clinical side, right? Right, Jan?
Right. That's what I mean by your business when I say that. I do mean the clinical. They are going to have to tell you, oh, this application, I don't really need that, or this is what I need to deliver patient care, and these are the ones that I can't do without. That's going to have to drive your business continuity planning.
So it has to involve their workflow.
Right.
Right. Okay. All right. Where is the first place you would look to, based on your experience, for a single point of failure?
So just for me, I would always make sure that I'd start with power, and I would go up every layer, kind of everything that was involved to deliver service. So start with power, and then you go to your network and make sure you've got your redundancies there, and then you make sure you've got your redundancies in storage. And then when you get to servers, this is the one thing that's caused us trouble in the past, is some of the pieces, those infrastructure pieces that you don't think are required, and you may have put them somewhere that is a little more vulnerable, can always cause you a problem. So make sure you double check those infrastructure pieces. And a lot of times the only way you find that is testing. I can remember one time we had a temp file that nobody thought was important, and we put it on a lesser tier storage, and when that storage had an issue, our system was down. So you really have to know your application and know what's required for them to work, and then just go up every piece of that stack and then test it.
Okie dokie. So we always, in a lot of these webinars, of course, HIPAA is always a concern. And the question is there any HIPAA implication with a power outage and any other thing that might affect data recovery?
Well, you want to be like, so for instance, if your downtime procedures were to print a certain place, you want to make sure that that place was secure and people can't get to them. We have our EMR downtime report. We have a backup copy of it in our data center that we put on a thumb drive, and that thumb drive is password protected. So those are the kind of things you got to make sure for HIPAA, that you're still providing, you're still keeping that health information protected regardless, whether you're trying to do a restore and things are crazy, but you still have to keep that protected.
Right, right. Another HIPAA question. Do you have BAA, Business Associate Agreements, in place with all the vendors that you work with, Jan?
We don't have them with all, but we do have them with some. And I can tell you, sometimes it takes as much as 6 months to get those done. So if you think that might be something that you're going to either remote host with that vendor, or that vendor is going to have access to your data, my advice would be to start those BAAs sooner rather than later.
Right, right. Because there's always a lag time, or even at the, if it's a new vendor, that is part of the RFP process, before you actually, sign on the dotted line and write the check.
Right.
Well, and you have attorneys involved on both sides, right? So that, sometimes can cause time, add time.
Can lengthen the process.
Sometimes that can lengthen the process. Yes, exactly. So with just a couple minutes left here, we're wrapping up. Again, for those of you who are chatting in with me, we will get a copy of the recording and, of course, the slides provided out to you within 24 hours. Before we wrap up, Molly and Jan, any last thoughts before we head out the door? Or
I would just say,
oh, go ahead,
I'm
Jan.
sorry. I was just going to say, make sure that you're testing those, you're checking the redundancies, you're recording them, but you're also testing them, because I can't say that enough. You got to make sure that what you think is important is really important and necessary to keep the applications up and running.
Right, right.
And I just wanted to make one final comment because we had that question about MPLS.
Right.
So I think you just need to look at what kind of bandwidth and requirements that you have. So, there are, at least anyway, on the layer 2 level, there are wavelength type of services. So if you need really, high availability, low latency type of service, then you may need something more like wavelength. If you have a clinic location that the bandwidth requirements are not, not as intense, you may be able to manage with a broadband connection. So especially with a technology like SD-WAN, it can help manage those applications and make sure your availability is high, even though you're using the low cost broadband type of connectivity. So it does really depend. You have to look at your locations depending on your needs.
Right, right. And always make sure you have more than enough bandwidth, not like right at the edge, correct?
Yes.
Yeah.
Yes. And,
Yeah.
and especially with MPLS services or fiber, I mean, it can take time to get those kinds of services in. It's not just a week. You have to order those services, and it takes time to get that in, especially if there's any kind of build or fiber digging that needs to be involved. So,
Right.
so you have to factor that into your timeline as well. Obviously broadband is probably something you could get very quickly. But if if you run out of bandwidth, it's not like you can get that tomorrow. It takes time. So.
Is that more difficult in like rural? I'm just curious, if like in rural areas or.
Yeah. I mean, it really.
Yeah.
I mean, there is a reason why in rural areas that connectivity costs more because the infrastructure isn't necessarily there. So if there are still places in the country where they don't have internet in the ground. The only way they can get internet is with satellite. So,
right.
So if you have those kinds of scenarios, it's it's more expensive one, and the time to take it to get additional bandwidth would maybe even take longer. So,
Right. Got it. All right. Well, Molly and Jan, thank you so much for your time today. And like I said to the attendees who keep chatting me, yes, you will get a copy of the recording and the slide deck out. We appreciate you taking time out of your day to attend today's event, and we look forward to our next Answers Media Network. Molly, Jan, you guys have a great day.
All right. Thank you so much.
Thanks. You too, Carol.
Bye.